So hello everybody, my name's Steve. I run technical solutions here at Gigasheet. We are graced with Jason Hines' presence today. Jason is our CEO and an expert and slowly becoming an expert in this subject itself. We're going to talk about Gigasheet for price transparency, and specifically how to work with these giant MRF files that various health insurance companies and hospitals and the health insurance industry are now making available to the public. The transparency is transparent in name only in some way, in their opaqueness. Jason is going to show how to work with these and how to actually solve, how to do complex analysis using these huge files. So with that, Jason, I'm going to turn it over to you.
Yeah, thanks, Steve. So, as Steve mentioned, today we're going to be focused on healthcare, specifically transparency and coverage and MRF or machine readable files, which come in JSON format or sometimes CSV. So we're going to go pretty deep on the healthcare use case. We'll talk a little bit and show some of the basic functionalities of Gigasheet as well. We have customers that use us obviously for healthcare data like this, but also financial reporting applications as well as sales and marketing use cases. So today is going to be a deep dive on healthcare and MRF stuff. So stay tuned if you want to see some basic feature functions, but get prepared for that. The whole idea behind Gigasheet and why we started this company about 4 years ago is we were like, look, not everyone can code and use databases, but there's tons of big data out there in the world. And when it gets past a size that you can manage in something like Excel, you typically need to go set up a database or get engineering involved and set up additional infrastructure. And often that's a lot of work to do just to get answers to relatively straightforward questions that you could find answers to yourself if they were in Excel. But because of all the infrastructure and barriers involved, it becomes very burdensome. And so the whole idea is you shouldn't have to be able to write SQL or code or use databases to do this. You should be able to have an easy to use, approachable spreadsheet-like interface. And that's really what Gigasheet does. It does it on top of databases, data warehouses. If you don't have a data warehouse, you can use ours. And it even does it on top of files like MRF files. So one of the things that we started seeing a couple of years ago in 2022 after the transparency and coverage rule was put into place is people loading JSON data into Gigasheet. As I mentioned, Gigasheet adds a spreadsheet-like user-friendly interface to all different types of really large data. So it would make sense. People are trying to do this in our product. But frankly, the data was unusable. And what I mean by that is not just that it is bad or noisy data. We still see a lot of that. But I mean, it was not well formed at all. And meaning it was kind of like a corrupt file, if you want to think of it that way. And it was a huge mess. And we were trying to work with people and help them. And we were like, I don't know what to tell you, but this JSON file is not well formed. Fast forward to about last summer when we saw the government put out an improved schema for these MRF files or machine readable files where payers publish negotiated rates, and they're required to now publish these negotiated rates and make them public. And the government published an improved schema. So the data, I don't think this was necessarily hospital or insurance companies were at fault. I think there was just not a lot of guidance around this. The guidance improved, and since then, the data has become much more usable and valuable. It's still a big mess, though, I'll say that. And what we're working to do is simplify it dramatically here. We'll talk about some of the issues that we see with these MRF files. In particular, they tend to be huge, huge data sets. Sometimes it can be multiple gigabytes of data in a single JSON file, and other times it could be hundreds, thousands, or hundreds of thousands of smaller files that have to be combined, lots of duplicate data in these, so it has to be kind of cleansed and transformed. And Gigasheet's platform actually does that automatically now. There's also a problem which has kind of become known as zombie rates, where insurers are interpreting the rule to be that they have to publish every rate for every provider in their database. So that creates a huge combinatorics issue where you get and you get a lot of irrelevant stuff. So you get like ophthalmologists who have a negotiated rate for a total knee, or you get a chiropractor and their negotiated rate for open heart surgery or something like that. And it's just irrelevant kind of data. And so all of that has to be removed, and there are several tactics that are available to do that, but our platform also now does that automatically using a combination of reference data, taxonomy codes for providers, and even AI. The results can be hard to interpret, and we're going to dive deep into that today, and I'll show you how to wade through the actual data that's behind this stuff in MRFs. And these fields are often not aligned always well, and we'll show you exactly like what's going on behind the scenes with this data. So we built Gigasheet for price transparency because while there are a number of providers on the market who are using data from MRFs and price transparency data, there don't seem to be a lot of tools out there to really work with this. So a lot of people, whether they are in the ecosystem, are actually using Gigasheet to sort through this data or to inspect quality and even to OEM this into kind of as a pipeline, so to speak. So there are all different kinds of ways you can use this data, many different use cases, in negotiations, obviously, to do competitive intelligence, a lot of applications within the self-insured ecosystem for employers, as well as investigating high dollar claims, which we'll talk about today, stop loss. There are many. It seems like every day we learn about a new way people are thinking about applying this data. And so an exciting time to be involved in this. So what Gigasheet offers are tools and infrastructure to process MRFs. And we'll talk about what happens in that processing, and then the tools to analyze the data that comes out of it. So the data can be based on markets or locations that are kind of selected by our clients, and can be done on demand. It can be organized by taxonomy, and PI codes are added. We'll show you exactly what's included with that. There are a lot of insights about those specific providers. We have people who are using it for everything from like marketing and recruiting providers to just understanding, market trends. And we've also integrated Medicare rates, and we'll show you how we've done that. So you can compare and see what Medicare is paying or reimbursing for specific CPTs, and they're adjusted regionally. So uh, as you might expect, if you're in Manhattan and you get reimbursed more for a total knee than if you're in rural Arkansas. So we've incorporated a lot of that, and there are a number of other ways to work with this. So kind of how it works is either we source the MRFs. Often we do this for our clients where we source data from the networks or the payers that they're interested in. And then it goes through an ETL or extraction, transformation, and loading process. And but we have a lot of people who also drop MRF files in and do this work on their own. And our platform does a lot of this preparation and flattening and organizing of the data for you. And with all of our plans for Gigasheet for price transparency, you actually get access to the platform as well as the data. So you can drop in your own files whenever you like. So the next step is cleansing and enrichment, where we do a lot of that deduplication, adding the NPI and taxonomy information, removing zombie rates, adding CMS data as well. And then it's ready for delivery and analysis. And optionally, you can get refreshes on this data as well. So we're really going to focus on the delivery and analysis step, and I'll take you through it. Um, so, oh, I should also mention, uh, happy to take questions, Q&A. Just drop them in the Q&A panel, and I'll take them at the end. I saw one question come in, so I will we'll go through this, and then I'll take questions at the end. So please
Yeah.
do ask questions. Yeah,
And before anybody asks, yes, we will be recording this, and yes, we'll be making the recording available. So that's always the first question.
yeah. So thank you, Steve. That's right. Um, so yeah, let's get into it. We're gonna. So first of all, I'm not an investigator of claims. I'll just be upfront and say about that. Very familiar with this MRF data and the work that we've done on it, but um, so you'll have to humor me, and we'll just kind of pretend here. So, in the case of, say, stop loss, or maybe an employer who's self-insured and they're investigating a claim, you may see something come in that looks a little suspect. And one way to investigate kind of what going rates are is to look at MRF data. Now, historically, I think people have looked at his, claims that have been anonymized that are available, but they're often can be difficult to compare. And this is just another data point that can be used in this whole ecosystem. So we're going to look at this ICD defibrillator procedure specifically, and this hypothetical made-up scenario. We're going to look at, I'm going to show you how we can drill down to just Miami, Florida. And we're going to look at rates from Aetna, actually, in this example, but we could do pretty much any payer. Um, we're going to also show you how we benchmark against Medicare reimbursements. And we're going to look at some data from hospital data, too, so data from hospital systems. So with that, uh, we're going to get into the weeds now. So hope you're ready. For those who aren't familiar, this is Gigasheet. It kind of looks maybe like OneDrive or Google Drive, where you have data and files. These could be databases, warehouses, or in this case, these are MRFs that we've brought in, and these are hospital MRFs here. And then we're going to dive into a file I've got open here, which is Aetna nationwide data. So when you first drop in an MRF to Gigasheet, um, depending on which tier you're on, you'll get something that looks like this. This is our price transparency offering, and this is what the data looks like when it goes through all those steps that I showed before. And if you haven't seen it before, uh, I'll orient you to the data, and then we'll talk about some basic feature functions of Gigasheet, regardless of what data you're looking at. Could be anything. And then we'll dive into some of the steps to actually uh, investigate that claim that I mentioned. So, you ready, Steve? You look enthralled. Um, so let's just start by taking a look at the columns that are available here. There are 32 columns we're looking at in this particular data set. When we actually deliver the data, it has upwards of 76 columns right now, and it can include more. Again, this is all done on demand, so it's based on customer requirements. But you can see here we've got a procedure name, a description, billing code, negotiated rate, and a lot of NPI data has been added here about the provider's location, practice information, and that kind of stuff. But we're going to focus really on these rates. These are the negotiated rates from Aetna. We have a negotiated type. We can see here it's fee schedule, percentage, or negotiated. And in this particular column, we happen to be able to see that. We, we've got the Medicare rate, which is the non-facility rate that we brought in from the physician fee schedule, adjusted for the location. And when I say adjusted for location, I will jump over here and show some of that NPI data, where we've got the provider business name, first name, last name, and of course, city, state. We also have zip code of that, as well as their taxonomy, primary taxonomy codes, and any license information that's available on the NPI registry, and then a whole host of other fields here. So based on the practice location, we're able to infer what the Medicare reimbursement rate is there. based on the data that's been enriched here. So let's start by just exploring this. Here I can see three different types of negotiated types. And if we use something called groups in Gigasheet, we can aggregate this data and get a better sense for it. So you'll see here when I clicked on the column menu that I've got a spreadsheet-like ability to see what's available. And I can see here there are three different um, parameters in this particular field. And if I group by that, I can create an aggregation where I'm able to see a row count for these. So in this particular file, we have 7.5 million rows. Now we're just looking at common high cost procedure codes here. We limited it down for demonstration purposes, but we processed for, in this case, Aetna nationwide for everything, but it's just a massive data set. So it starts as about 7 or 8 billion rows of data, and then after filtering, it gets down to several hundred million rows, and then we picked a basket of CPT codes. And we can see here that we've got, 2.7 million rows in fee schedule, about 4.4 million rows that are negotiated rates, and then percentage rates as well. I can expand these groups to look at the details within it. I could also create subgroups. So there's all different ways to explore this data. For example, here we can expand percentage and then look at percentage by particular procedure. We could, instead of row count, look at, say, an average of Medicare rates for each one. So now I've calculated this. So lots of different tools within Gigasheet to explore data using groups and what so move these and procedures, the basket of high cost claims data that we've limited this to. So there's 24 in this particular data set. The names of related to the defibrillator, I'm going to do some investigating. So first, let's filter to that CPT code here. So I'm going to say billing code equals, I believe it was 33249. Okay, so of the 7.5 million rows, we have 136,000 rates for this particular defibrillator procedure, which is interesting. I've got, as I mentioned before, negotiated rates, percentage rates, and fee schedule. So in this case, I really just want to look at, let's say, negotiated rates. So I will right-click on this field and say filter to this. You'll see there are multiple different ways to filter or query, slice and dice this data. But regardless of how I'm doing it, whether I'm using the checkboxes here or right-clicking on the sheet to filter to it, we have this filter panel, which basically keeps up with all of the different rules in my query that I've built here. So hopefully this makes sense so far. So now let me open that back. We're looking at just this billing code, and we're looking at just this negotiated rates. And you can see here I've got this aggregation where I can see the average Medicare reimbursement rate is $880. And then we have this negotiated rate, and maybe I'll add a different aggregation here and just kind of check out the range, which is substantial. There's a $62,000 range for this particular procedure, and that is a bit mind-blowing, but that's what's in this data set. So let's continue our investigation here. So I see this billing class here, which is professional, which is good, but I might want to see what else is available in this data set. And I can see institutional is also available here. But it's almost all professional data. For these purposes, I'm going to filter to this and just look at professional rates. Again, just for reference, now we're looking at this billing code, negotiated rates, just among professionals. And then I'm going to filter down to that location of interest because I want to see for this particular claim, maybe it's in Miami, and I want to filter to that. And the way I'll do that is say location. I want to go to this column for the city name. I'll put in Miami, and I'll also choose Miami Beach in this case. I'll also add a state. Um, of Florida in case there happen to be Miamis in other states. Probably there are. So now this is the query I've got. And I can, worth noting, I could always save this query. So like if this is something I do commonly and maybe I just want to update the city and state, I can do that. There are lots of tools within Gigasheet to kind of save your work. You can create views, which you could share with other people. It's a very collaborative, pretty straightforward to use interface. So now we're looking at, let's just verify and scroll over here. So now we're just looking at Miami, Florida, which looks good. And we are looking at, we've got our place of service codes here. So I could filter by that as well. But for now, I'm just going to look at everything. And I can see this billing code modifier column, which is important. And if I do a unique count on this, I can actually see that, yeah, there are other um, modifiers that might exist. But I know from working with this data that Medicare generally doesn't use these modifiers in their reimbursement. So I'm just going to filter out uh, only to the blanks. And you see it added a filter here. So it says where billing code modifier is empty. So I'm not really interested in any that include modifiers. So now I can really start to get like an apples to apples comparison of providers in the Miami, Florida area. And I see my Medicare rate is the average is the same, which makes sense. That checks out. You know, everybody should be getting paid the same. Um, and then I've got my negotiated rates here, which are what Aetna has negotiated with the providers. We can see there's still quite a range here, but we could look at the average, for example, is like $1,300. And I can also see the percentage reimbursement for Medicare. So if I wanted to, this is uh, look at kind of what uh, the top or bottom reimbursements are in the Florida area, I can see these people are getting more than triple the Medicare rate. So if I was shopping for, I could easily integrate or overlay quality of care data here. There are tools within Gigasheet to do things like VLOOKUP, for example, if you're familiar with spreadsheets. So if you had another data source, we can easily help you layer in additional data. But in this case, we just are able to see the Medicare reimbursement percentage, and we can kind of get a sense for exactly who's getting what in the Miami area. So that's pretty good. So now we're down to a pretty clean set of data that we can use to analyze this. So if you have questions, feel free, post them in the Q&A, and we'll come back to it. Next, we're going to jump to hospital data. So in my library, I've got data for Florida hospital systems that we've pulled in. You can see it's a lot of gigabytes of data here that we've already pulled in and processed. And in this case, I'm going to zoom into just Jackson Health System. And they've got 4 hospitals here that we've pulled in the TIG files for. And they range from about 4 to 5 million rows of data. These come in as CSV files. They look kind of like this when they first come in. And you can work with CSV files perfectly fine in tools like Excel or other spreadsheet products, but where usually Excel, like I said, taps out around 1 million rows. So this is beyond that's capability. Another nice feature of Gigasheet, regardless of what you're using it for, is some handy tools to combine these. So what I've already done here is use the combine files feature. I can see these all have 27 columns of data, and I hit combine files, and I was able to merge all these into one file. It takes like about 30 to 60 seconds, depending on the data. This is kind of a lot, so maybe it took, 30, 45 seconds. I went ahead and did it so that we don't have to sit here and wait. And the data looks like this. Now, I did add a column for source so I can keep up with which hospital these standard charges came from. And if I perform a grouping here, you can see I've got my 4 hospital systems here. And you can see how many lines of data or rows of data I have for each hospital. So these files look a bit different than the MRF files from Aetna and from insurance companies. I have a variety of different codes. Hospitals use different coding systems, revenue codes, etc. But I can see here they use the HCPCS code, and they're specifying inpatient, outpatient, and here's the actual code, and here's the code type. Um, I've got some negotiated dollars. There are a whole bunch of columns in this. I won't go over all of them, but you can see I've also got payer and plan name as well. So I could group and look at what payers have negotiated rates with these hospital systems. And just like before, I could drill into these and inspect the data or filter it to any of these if I had a particular plan in mind that I was interested in. In this case, I'm just going to stick with everything, but I will filter to let's just look at inpatient. In our hypothetical claim, I think we'll look at inpatient, and if I just scroll over just for completeness, you can see, they have a cash discount. They also include some notes here. A lot of data in this, which I won't cover all of it, but what I will do is go to this particular HCPCS column, and I'm going to put in the CPT that I was interested in, 249, and we'll filter this down. So you can see the combined file is about, right now we're looking at about 9 of the 17 million rows, and I've filtered to this. So we started with 17 million, we limited it to just inpatient, and then now I filtered it down to this particular code, and we're looking at just over 1,000 rows of data. So I've got these negotiated dollars here, but then I have a bunch of blanks where maybe there aren't negotiated rates in this case. So I'm going to filter to exclude those. And now I'm down to just about 300 rows. And I could look at the range here that the hospital's negotiated charges are, and it's quite significant. So this is how you can work with data in Gigasheet to investigate what's really in these MRF files. So I might drill down further here and look at it by location, for example. In this case, the range is the same. I could maybe hit the average and kind of see what it looks like. And then maybe let's layer in the particular payer and just drill in further. So now I start to see like there's some real variance within this. And if I'm only interested in, say, Jackson South, let's filter to that, do some quick analysis here, sort in descending order. And now I can see what's most expensive, who has the highest negotiated dollar amounts versus the lowest in this case. And the query for that is here. So stop there. Could keep going forever, but that's basically how you can use Gigasheet to do some really in-depth analysis around claims, and how it works. I think I had one more slide. Generally, kind of how our solution works is, I should mention that we actually do sell this product, and so Uh, our solutions, like I said, this is basically MRF processing on demand. So typically the way it works is our clients select payers, locations, and then optionally specialties. We can absolutely do like every pairing between specialty and CPT code. And as I mentioned, we use a combination of publicly available claims data and also AI to make sure those pairings are relevant so that we're not getting ophthalmologists doing total knees and cleansing that. So, the cool thing about this is it's super scalable. So we work with everyone from small practice groups to really large organizations that are interested in nationwide data. Um, yeah, that's Gigasheet for price transparency, and that's how we investigate high dollar claims and also benchmark against bring in Medicare data as well. So with that, we'll open the floor for questions.
We've actually had a number of really good questions. So I'm just going to tee you up and
Yeah,
take them
let's
in
do
order.
it, and I'll try to answer them and not mess up.
And if you don't, we'll make, snide remarks. Um, the first question was actually, this was before you showed those hospital MRFs, but can this approach be applied to hospital MRFs? But maybe this is a
Oh,
good time to talk about which MRFs are there specific ones, national, regional, states focused, payer focused. I want to talk about that a little bit.
yes. So all of the above. I showed data that's like nationwide data for Aetna and high dollar claims, but frequently we work with regional stuff, like just for a state or just certain networks, like regional networks, where you might be comparing. Um, Especially if you're a broker and you're helping to guide your clients to low cost, high quality care or to networks that are maybe more efficient based on their census and things like that. Yeah, it can be I mean, really all types of data. I mean, we have a whole sheet of just NPI data, for example, or a whole sheet of just the CMS clearinghouse claims data that you can use this for. Um, like I said, we prepare and do a lot of this work with our clients for Gigasheet for price transparency, but you also get access to the platform. So you can drop in files at any time you want and work with them. And yes, it is a broad range of capabilities from hospitals to regional payers to nationwide giant things. Yeah.
The next question, that's great. The next question is, can we upload JSON files into Gigasheet and it gets the tabular format as shown in this example?
Uh, yes, with the price transparency. So we have a business plan. So we have two tiers that can do that. So if you upload a JSON file into Gigasheet with our business plan, it will translate the JSON to a tabular format. It will not include all the NPI details, taxonomy codes, CMS rates, which are necessary for it, and it will also not remove the zombie rates or do duplicates. So it will, to answer the specific question, it will convert it to a tabular format. The price transparency offering, the difference between the two is the price transparency offering takes those additional steps to do the cleansing and enrichment. We have people who work with JSON files in Gigasheet that are not related to healthcare, and that's what they use it for. Um, yeah,
But the price of transparency is essentially more than just what's in the MRF file. It's the data from the publicly accessible MRF file joined with other
yeah.
supplemental data sources.
Right. It's the MRF file, just tabularized, but like I said, without the NPI linking.
API.
If you're specifically interested in that, we can show you exactly what it looks like with either tier.
Yeah.
Um, it is doable, especially if you have a modest set of data, you could do it on your own. Um, but if you're working with really large data sets, you're going to run into um, just need for more compute and power to get it done. And that's why we have this offering.
Mhm.
Yeah.
The next question is, can you merge hospital files if the column count is different across the different files?
Great question. Because let me tell you, like these hospital files have their own issues, and they are not always as beautiful and clean and consistent as they look in my demo. Let me see if I can find, I might be able to show an example, but yes, we have tools that allow you to work with or pick a subset of columns and combine those files. Let me get back to,
Yeah.
let's see.
While Jason brings this up, I can say,
Yeah.
yes, we can combine files based on column order, based on column headers. If you have mismatched columns and you want to go by column header, we will still join the files and you can choose whether to keep, and essentially just keep appending to the right new columns. Or if you want to drop them and only combine the ones that match, we can do that. But the short answer is yes, we can combine files with multiple different column counts.
So let's look at a real example. I forget. This one, these guys publish in JSON, Cleveland Clinic. They're pretty clean. One of these, if you bear with me. So these all look good, right? Except for this one. You often this happens when maybe they've acquired a hospital, right? So these all have 22. This one has 25. I'll just give you a quick preview. I'm not going to go through the whole thing here on the fly, but you can decide to join based on column headers or the column order. So you need to kind of suss out what's the difference with this particular file. Probably what I would do in this case is combine everything except this Wolfson Children's Hospital and take a look at it, see what's going on there. If 22 of the 25 columns overlap, yeah, you can definitely combine it here. Might have to rename them or reorder them slightly, but there are tools to do that, as Steve mentioned.
Yeah.
Good question, because that
Somebody,
happens.
yeah. Next question is there a way to crosswalk between payer and hospital files based on NPI?
Is there a way to crosswalk between payer and hospital files? So usually NPI isn't included in the hospital files, uh, to my knowledge. I haven't seen that, but I suppose, but if the NPI did appear in the hospital files, yes, it's definitely possible to crosswalk between hospital files and insurance files based on cert, you know, the hospital codes, the HCPCS codes are inclusive of CPT codes, but they're more expansive. So, uh, yes, if there's NPI data in both, it is possible. And I
Is
would be interested to hear if you've seen NPI data in both. Maybe I missed something somewhere, but I haven't seen it. Yeah.
is Gigasheet able to confirm CMS JSON schema compliance?
Oh, like you want to upload your MRF and see if it meets their criteria. Um, so they have put out a tool on GitHub that is supposed to validate that um, I won't say that it's compliant, but they put out a tool on GitHub that it's formed properly. And so got to be careful about the words because to be compliant, you need to include all of the negotiated rates and various other things. So you could use Gigasheet certainly for data quality inspection. And let's say you had produced an MRF that you wanted to publish, and maybe you have a CSV dump or a database from the hospital, or you're working with a insurer, a carrier, and you want to compare the two. Yes, there are tools there for ensuring that there are entries for everything. I can imagine a couple of different ways to do that. Um, so No, we do not have a tool that validates that your MRF is meeting the criteria. But if you were interested in doing data inspections or like comparisons between lists, let's say, and you want to see what's missing and make sure there's a value for everything, yes, we could do that. So maybe need a little more information to answer it, give a better answer, but
And
yeah.
somebody said I have a subscription to Gigasheet Premium annual subscription. How do I go about getting national access to a single taxonomy code?
Ah, yes. Well, national access, I guess we need to define what that means, for one payer, for like five payers, for what? Uh, this would reach out to us and we have some more questions, I guess, that we would want to know. You want a single taxonomy code? I think that
Since
to do that,
all
huh?
payers,
What's that?
all payers. The guy who,
All payers?
oh,
Uh, it's going to be quite a bit much more expensive than $300 for all payers. Um, And the other thing you would want to do is based on that taxonomy code, we would want to look at a certain set of CPTs for that particular taxonomy and limit it to that. Uh, for all payers, I mean, usually what you end up doing is picking like the BUCAs, like the Blue Cross Blue Shield, United, uh,
ten
Cigna,
CPTs,
and all CPTs that
10
are
CPTs.
and
Yeah.
CPAs. Yeah, I mean, we can do that. It's going to be quite high.
I think the answer here is let's reach out and have a conversation.
Yeah,
To
I
define
mean,
your
I will
requirements
tell
here.
you, it's not going to be hundreds of dollars a year. It would be thousands of dollars a year to do that. Uh, so
Okay.
anyway,
Um,
let's keep going.
I got a couple more.
Sure.
Do your customers ask for facility fees, and are you able to cull it from someplace?
Uh, yes. We had what I was showing is non-facility fees, but we also have facility fees. So yes, and we call it from the physician fee schedule. And yes, so you know, Medicare doesn't do it for every single CPT, but the short answer is yes, we do have that. And I think I might have even had it in that file, but I might have hidden it. Um, yes, we definitely do that.
Are you able to quickly get the latest billing charge, not the rate? Don't give me a rate. I want the latest billing charge of a service for a particular provider or facility. I think you mentioned you work with claims.
Uh, Claims data, we work with less. We work with some publicly available claims data. You know, there are companies that just specialize in sell claims data, and that's not us. So no, no is the short answer. However, if you wanted to do that, uh, you so say it again. Do you want the current price,
Are
like
you
consumer
able
price?
to quickly get to the latest billing charge, not the rate, of a service for a particular provider or facility? You
I guess
stumped
I
him.
need a,
You stumped him.
I want to know what the difference between billing charge and rate is. I guess I'd need to understand that. Maybe I just am missing
That
the
question came
concept.
in anonymously. Please reach out to support@gigasheet.com and we'll whoever you are,
I would,
and we'll talk.
yeah, I would love to dig into that a bit more. There are a number of ways, like hospitals publish other data as well that's more consumer facing that may be more useful. Um, I guess I just really need to understand what the difference between rate and um, what was it again? Charge? Something?
Latest billing charge, not the rate.
Oh, they
Anyway,
publish.
let's answer.
Well,
Let's end on
I
this
have
one.
some ideas on that, but I guess I also have questions too, so
Yeah.
I'll be careful on that one. Yeah, I don't want to.
We're going to end on this question. Can the clean data be transferred to Excel prior to use, or does that defeat the purpose of your platform?
Oh no. We're pretty open. Like, so this is actually something that's also different is this data is accessible and able to be exported. So let me just show you. I should have shown that earlier. Um, Jump back into Gigasheet. This is one of those hospital files we were just looking at for uh, my Zoom thing here. But this is a different, totally different hospital file in Florida. This is a big CSV. It's 78 million rows of data, right? So you can't work with this in Excel. There's a whole set of APIs behind Gigasheet where you could filter and pull data dynamically in slices. But let's say I filtered to just, I want to look at like outpatient data and I want to look at, um, I don't know, any standard charge gross that's over, uh, I'll just make something up greater than 50,000. And I hope there's data in here. I don't know. Probably should have done that. Okay, so now we're down to 107,000 rows of data. Um, totally can do this in Excel. Maybe you want to layer it in with other models you're working on, whatever. You can download data to CSV. Uh, if it's too big for one CSV, you can split to multiple CSVs. If you're working with a data warehouse, you can push it to a database or data warehouse. We work with just about every single popular database or warehouse here. This is just configured my account for Databricks Snowflake SQL Server. But there are numerous ways to get data out of here. Usually, with such large data sets like 78 million rows, Gigasheet's a really handy tool to just kind of explore, slice and dice, and then when you're ready, um, pull it out however you want. Uh, yeah,
Okay.
that's
It
it.
is 147. I feel like that is we got a ton of great questions here. I'm
Yeah, I
amazed.
love the questions.
Love the
And
questions.
if anything I said didn't make sense, or maybe you have additional context, we'd love to talk to you. You can email me directly at j@gigasheet.com or support@gigasheet.com. Um, I love digging into data, so happy to help. Thanks for joining, everybody.
Thanks, everybody.